Welcome back, everybody, to Empower TV, your 5-minute therapy with Monica. It's so nice to see you again after a bit of a break. So, today, what I want to talk about are headaches. And, with the time changes, with the seasonal changes, we often start having headaches. I've been seeing a lot of people in my practice coming in and complaining about my head's been hurting. I've been feeling kind of woozy. What can I do? So here's my answer. Let's talk about a few simple techniques you can start to apply today for your headaches, if you're having headaches, or actually to prevent headaches, to move, create more space inside of your skull and let your brain breathe. Okay? And I want to make a disclaimer because if you're familiar with myofascial release, if maybe you've been coming for therapy, if you've been following our channel, you know that myofascial release is not ever about just treating the symptom. It's not just about treating the place that hurts, because the fascial system is completely connected inside of the body. In fact, it is your body. There's no fascial system outside of the body, and there's no body outside of the fascial system. It's that beautiful web of connections that holds all the cells inside of your body and all the cells, organelles, all the way down underneath that cellular level is the fascial system. And so everything's beautifully entwined and connected in our body. So we as human beings, because we come from our intellectual mind, we oftentimes think about treating the symptom. Oh, this hurts. I need to push on that and work on that. Yes, sometimes it helps, and we need to honor what our body is feeling. But on the other hand, I want you to really start thinking about your body as a connected whole. So just before we go into actually treating the head for the headaches, I want to make that disclaimer that oftentimes headaches are not originating in the head. They may originate in the tight neck. They may originate in the tight chest, maybe even your diaphragm, okay? Your diaphragm is right here under your ribs. It may be tight. What happens? If I am tight in my diaphragm, it starts to pull down, starts to create pull on my chest into my neck. It may actually create pull of the fascial system as if I had that tight hood over my head, starts to compress my skull and compress the brain inside of my skull. And then I start to have headaches. So oftentimes we also see jaw problems that are related to headaches, and treating the jaw directly helps the head. So let's be open-minded and always think of our body as a connected system. And that's why I want you to be coming back and watching different videos on different issues that we are talking about. But let's delve into a few simple techniques. If you're having a headache today, or hopefully you don't, but if you have a headache in the future, these are simple, really easy and fun things that you can do. And remember, with myofascial release, the key is, number one, we never force. We never push the body too hard. Number two, we always do everything for at least 5 minutes, because that is what it takes for the fascial system to release the tension and restriction that puts pressure on your nerves and blood vessels and creates pain in turn. 5 minutes, that's what it takes at least, sometimes it's more, to start to let that fascia to melt, to release the pressure, to release the compression. Okay, so one simple thing that I've learned how we can treat our headaches, and forgive me if you don't have hair on your head, this may not work for you, but if you do have hair, simple thing, you're just gonna grab your hair and pull up. One thing you can do is actually place your elbows on the table, on support, so you can actually allow your head to just melt down. And I'm closing my eyes, allowing my head to start to sort of unwind a little bit. I'm not thinking about my hair and how messed up it will look like after I finish. I'm just allowing my head to start to float. And it does help. I'm not doing that right now for the purpose of the video, but it's absolutely very helpful to have your elbows on a table or some other surface so that you can support yourself and let the gravity take your head down and let that skin kind of peel off your skull, taking that tight fascia with it and letting everything melt. This takes off pressure out of your skull. Okay? So this is technique number 1. I'm gonna fix my hair a little bit, forgive me. But I hope you understand that my hair is gonna look really messy right now. And that's good. So technique number 2, there is an important bone inside of your skull. It's called the sphenoid. You don't have to remember the name if you're not, a medical professional. The sphenoid that actually is the base of your skull. It's sort of like a wing. We talk about 2 wings of the sphenoid. In the middle of the sphenoid, we have our pituitary gland, which is the master hormone gland of the body. Oftentimes, that bone is embedded in a really tight fascia inside of your skull, and it becomes sort of distorted, pushed into different directions. You can just imagine what it does to our hormonal balance. It actually can distort the pituitary gland and create hormonal issues for us. But also it kind of takes the fascia with it and starts to compress, the fascia starts to compress those sensitive structures inside of the brain and create pain. So that's another way or reason why headaches can be created in the body. So the sphenoid we access actually, if you feel into if you feel your cheekbones going up here, your eyebrows going down, you feel that soft spot right with the counter of your eyes, and you can kind of feel it, massage a little bit so you can feel that you're in the right spot. So you can do this with your fingers. It's actually really helpful to lay down on your back. And all you do is sort of really gently, you can close your eyes and just imagine that your fingers have those laser beams coming from the tips and going inside of your head and connecting with that sphenoid bone and just pulling. I'm just connecting here, holding firm pressure, slightly firm so that I don't slide, right? So I connect with my skin and I'm just pulling the whole thing up towards the ceiling. So if I'm looking up the ceiling, I'm going to be pulling it up towards the ceiling, right? This direction. Another cool way to do it is you can take your hands and just place them right. You feel those indentations right there. So it's like a hooking point. And again, just like we did with the hair, you're allowing your head, and again, it's good to put your elbows on the table. I'm not doing that, but you can, right? And I'm allowing my head to pull me down, right? And I'm still keeping that slightly firm pressure right into that indentation. So, wow, this really feels good. And you don't have to understand why, and you don't have to understand what the sphenoid is. But if you try that, you feel like your head is actually opening and you're getting more space inside of your skull, which in turn really helps headaches. But always remember, you want to stay with that for at least 5 minutes, okay? So we talked about the hair and we talked about the sphenoid. Another fun technique is ear pulls. So this is a sure way to get your ears to grow and become like big elephant ears. Okay, just kidding. But you want to grab your ears right kind of in the middle so you have, again, a good firm hold. And right here. I'm just holding with my fingers like a pincer grip. And again, it's very helpful to just lay down on your back and relax. And then you're just pulling your ears out and imagining that you're growing those big elephant ears sticking out of your head. And wow, this will feel good. You will start to feel the fascial system. This is a wonderful technique to introduce yourself to understand how the fascial system works in the body. Because as you stay here for at least 5 minutes, you'll start to feel how you get that pull and that opening, not just on your ears, but beyond your ears, inside, into the head, into the skull. So just pulling, and right now I'm actually feeling that behind my eyes, and I'm feeling that a little bit behind the lower part of my head where it meets the neck. So think about it, those two spots behind the eyes and right at the base of your skull, it's often where we feel headaches and tension. So just by pulling the ears, it's just as if I pulled here on my sweater, right? I'm going to be creating connection all the way to the other side. So this is how the fascial system works again, okay? So ear pulse, all right? So we work with the hair, we worked with the sphenoid here, right, directly on the head, and we worked with our ears. So these are really fun techniques that you can start doing for yourself. And I did mention the jaw. The jaw is often a big culprit of our headaches when we had maybe some dental work that was traumatic or painful. And that if we have issues with our jaw being tight, clenching, if we grind at night, oftentimes that tension here in the jaw creates a pull in the fascia. And in turn, because the whole system is connected, it pulls inside the head, creates pressure on the brain, and voila, we have headaches. Okay? So, great way, again, we're going to use the bottoms here of our hands, just like we did the sphenoid. You're going to find your TMJ, which is the joint here that moves. You don't have to know the names. You just going to find that place here. It can be pretty sensitive. Honestly, when I'm putting that pressure, I feel it's a little sore. So don't push too hard. All I want you to do is just create connection, like you're connected to the skin, and then just like we did the sphenoid, the head, you can place your arms, your elbows on a table and just allow your head to be pulled down with gravity. Your hands, all they are doing is just holding everything in place, supporting. Good. And I'm just releasing my jaw this way. So this is a fun technique. You can also do the same thing. Just hold here on your joint. When you move your mouth, you feel the movement. So that means that you're in the right place. And you're just going to pull forward. Very good. That feels really good. So you're just releasing some of that tension. And that's good for headaches. It's also obviously good for your jaw. If you find yourself in the morning waking up and feel like, oh, I've been grinding my teeth, I feel really tight, you can just do that first thing in the morning, 5 minutes on your jaw. And it will help you as well release some of the tension physically, but also oftentimes we hold that tension emotionally in our jaw as we're grinding, and maybe we're stressed out and nervous or angry, whatever we're experiencing that's negative. And actually releasing some of that fascial tension can help you release the emotion and the energy. So you get up fresh and happy and you are all set for your day. Okay, beautiful. So try some of those techniques. Let me know how it's going. I want to come back and talk next time about other areas in the body that we need to treat. Should we be experiencing headaches, tension headaches, tightness in our around our skull? because, like I said, let's remember that again, the body is connected. And oftentimes headaches are created by restrictions, be it in the pelvis, the chest, the diaphragm, the shoulders, etc. So for today, try those techniques. Remember, you do every one of them for at least 5 minutes. Let me know how it went, if you had questions, and how it helped you. And of course, always let me know what is the next thing you want to learn. Take good care, have a beautiful weekend, and we'll talk to you soon. Bye-bye.